We are happy to have you. And just to let you know, we are going to record the session, which is going to be shared at the very end of the program, just to let you know in advance. So we hope you had a good start. It's been 2 weeks now since you all had the chance to get together. We hope you had some first meetings and hopefully stimulating discussions around finding your research topic to get to know each other, get to know your group and also your organizational aspects. And just to start into today's meeting and training session, we have a little Mentimeter for you to share your current thoughts on how things are going, and specifically to also give a chance to reflect on the challenges that might have occurred. So I'm just going to share my screen in a minute so you can join the Mentimeter. So you should all be able to see the Mentimeter site right now. Please just scan the code. Otherwise, there's also the possibility to go to menti.com and use this code. And please share your answers, one or two feedbacks, whatever comes to your mind when reading the question. What is a current challenge that you anticipate in the current planning of your research right now? We know it's still very at the start, but nevertheless, they might have come across some complications, some challenges. So it would be great to collect them here. Okay, thank you. We're still waiting for a few more answers. Teamwork challenges, commitment with deadlines, lack of participation, not agreeing on one topic. Yeah, that's a challenging one. I know we have very diverse teams, so I'm sure there are some discussions around what to focus on. Time management, not adhering to deadlines. Okay. Well, thank you so much for sharing those insights. Please, whoever has just joined the room, feel free to still add things. Just want to refer to a few of them, but this is also meant for usable reflection, what to take back with you to your teams. Please feel free to take these and really address openly. I think this program is meant to also train team working skills. It's meant to bring you together and talk through those things. Open communication is absolutely key to manage some of those issues. Nevertheless, if a lack of participation or completely inactive team members persist over a significant amount of time, the team leads are also invited to reach out to us, and we will also check back with them to make sure that the teams are consisting of active participants. So if these kind of issues persist, please do not hesitate to reach out and use your team leads as a vehicle to communicate with us, the steering committee. According to deadlines, just as we had in our very first session, I just want to share this again with everybody who's attending here. Please see it as a joint responsibility to commit to the deadlines and to fulfill them. This is very important, not to let any of your teammates down. Of course, we all know this is coming on top of your existing commitments. So do try to communicate openly what you can take on your plate, and also, plan accordingly to these aspects. Agreeing to one topic is, of course, challenging, I know, but we've already heard some very interesting discussions going on. So we're very positive that you will find agreement here. Don't hesitate to use polls, to use mind maps, to use all those tools to come to a topic, and always know that this is also a learning experience. And maybe today's session, which will be around the different methodologies used in research, might also help you get it a little bit closer to what you want to focus on, as this is an important aspect to also know what's feasible. Which leads me to my introduction of our amazing speaker of the day. His name is Yusuff Adebayo Adebisi. He's a PhD researcher at the University of Glasgow. He holds a Master of Science in Global Health Science and Epidemiology from the University of Oxford. And as the Director for Research and Thought Leadership at Global Health Focus, he leads initiatives across over 26 countries to develop global health leaders and critical thinkers. He also he also serves as an associate editor at the Wiley's Journal of Public Health Issues and is an associate researcher at the Scottish Centre for Administrative Data Research. His work has earned him several awards. We have an amazing speaker here today, including the prestigious Princess Diana Award in 2022 for his contributions to science and research in Africa. Dedicated to addressing global health challenges, his research aims to enhance health equity and the quality of life through evidence-driven policies and strategies. Please all give a warm welcome to our speaker, Yusuff. We're very grateful to have you here today. I see you're already in the meeting. You are a co-host of this meeting, so you should be able to share your screen and your slides, and the floor is all yours.
Thank you very much for the introduction. Can you hear me?
Yes, loud and clearly.
I am super excited to be with you this afternoon, this evening, to share my experience. And to start with, I'll be starting with the fact that for health research, the very first thing that you have to consider, I know you have been thinking about your topics, what you want to work on. The very first thing is that you have to consider the feasibility of the project, and in fact, the research question that you want to answer. Because that's the most important thing, because you might have that big idea, but I'm sure the time might not permit, or you might not have the resources to do the research. So I'll be sharing tips, and at the same time, I will try as much as possible to make the session practical so that you can see what you can do and few lessons that you can actually learn from the kind of method that you can use for your research. So generally, we have quite a lot of research methods, and what actually determines the method that you're going to use for your research is actually the research question. We have some research question that you have a lot of ways that you can answer the question. For instance, if you want to do a research, and you can have different ways, different approaches of answering that research, the same research question. But what determines the research question that you're going to use is actually the one that will give you the best results. There's some research that the best approach that you can use to answer the research question is for you to do a review. There are some that what you have to do is to do epidemiological studies. So you also have to think about what you want to do, the kind of answers, the kind of responses, and the kind of detail that you want in your research is actually very, very important. And when you are coming up with the research topic or the research area or what you want to do, you also have to try as much as possible to make the topic specific. It's very, very important, because if you are trying to answer quite a lot of questions, quite a lot of research questions using a lot of approaches or a lot of objectives, it might be difficult for you to be able to refine and get very good evidence. Because the whole essence of doing research is to be able to gather, to be able to get reliable evidence, to be able to understand things better, to be able to answer our questions. So whenever you are coming up with any research idea or any research topic that you want to work on, you have to understand that the best approach is actually dependent on the topic or the research that you want to do. So this is just a preamble before I dive into the main talk of the day. So the very first research method I have here is epidemiological studies. And then we have a lot of studies, a lot of epidemiological approach that you can use for climate and health research. And what determines, like I said, what determines the approach that you're going to use to answer the research question is actually dependent on the question that you have and the resources that you have. For instance, if you want to do cohort studies, that means that you're going to follow a group of people for, let's say, 2 months, 5 years, 3 years. I know that is not feasible for this project, but just for a form of awareness that you can also use cohort study when you are doing climate research. For instance, if I want to understand why people are actually having a particular condition, so I have 2 exposures, let's say A and B. I can start to follow these people up and see whether the exposure is actually what leads to the true study. You can start to do cross-sectional studies. And if you look at the examples that we have here for climate research, this is something like longitudinal analysis of Earth wave exposure and cardiovascular disease in a large urban population. Let's say we have a particular exposure in terms of maybe heat wave in a community, and we decide to follow people up and understand what exactly is responsible, whether the exposure is what leads to the cardiovascular disease. We can decide to do a cohort study. Or if you are in a community and we want to understand risk factors, we can decide to do case control study to understand the risk factor of maybe for asthma when there is an outbreak, or where is an issue, or where we have an issue of wide fire smoke. We can decide to do a case control study. Also, we can decide to do cross-sectional study where we are going to measure both the exposure and the outcome at the same time. So, not to bore you too much with a lot of epidemiological method or approaches, what is important is that if you want to do any study, at the back of your mind is which approach is going to be the best for me to be able to answer this research question. Because, for instance, if I want to understand the experience of people, let's say, due to flooding in a community, maybe the possible health impact, or something that has to do with people's experiences, I want to do something quantitative. I don't want to use any epidemiological studies. I want to use qualitative study, maybe to do interview with them to know. Because if I do the interview, that will give me the opportunity to understand what is the research question. So what is important and what you pick from this is not too much epidemiology, but what is important is that if you want to assess some research question, the best way to do them might be for you to do epidemiological studies. And these are critical examples. If I want to understand maybe risk factor for asthma maybe in a community where we have wildfire smoke issue, we can easily do a case control study where we will recruit people that have asthma and people that don't have asthma. Then we collect information on the risk factors. And we're able to see whether wildfire smoke is actually one of them, whether the exposure to the wildfire smoke. So what determines what you want to do, what the research that you want to, the question that you want to answer is actually the approaches that you use in terms of epidemiological study is actually dependent on the questions that you want to answer. Maybe data is do a survey and get data on what is happening in the community in case of, let's say, you notice an outbreak, let's say cholera in a community, and you also have flooding in that community. You can decide to do a survey to see a possible link between the exposure and the outcome. So what determines whether you're going to use epidemiological approach is actually the research question, and you always have to put that at the back of your mind. Some surveys are enough. Some studies, core studies enough. Some studies, you just need to do case control study, and you're able to arrive at the meaningful conclusion. So another approach that people are now using when it comes to climate and health research is environmental monitoring. And this might be that, of course, you might try to maybe get samples from, let's say we have flood in a community and you want to see whether we have some maybe new microorganisms in the water. You can decide to just monitor the microbes level in the water. You can decide to monitor the microbe level maybe in the air. So monitoring is also another approach that we can use when it comes to doing climate and health research. And you can see an example here, some examples here, which include maybe seasonal variation in air quality and their relationship with the incidence of maybe acute respiratory infections. You can decide to collect data on air quality. There are different approaches that you can use for that. So you can decide to monitor every metal contamination in water and see whether there's an association with health risk in a particular community. So environmental monitoring is also a very good approach to study climate and the impact on health. So again, it's also dependent on what you want to do. For instance, if I want to maybe possibly explore maybe seasonal variation in, let's say in air quality and their relationship with the incidence of maybe asthma, I can decide to maybe take measurements across the years and see what is happening over the years. Maybe in May, we have this particular number of people with a particular disease, and this is the level of the air quality at this particular point in time. So you can decide to monitor over time and do some analysis to be able to find possible relationship between the exposure and the possible outcome. So environmental monitoring using environmental index, water quality are also means for us to be able to monitor exactly how we can know what is happening and possible changes in disease outbreak, in health condition, and possible impacts of climate change. So environmental monitoring is, I know this one is actually really capital intensive. And for this, maybe your project, this might not be feasible, but there's also an opportunity for you to have an idea of some approaches that you can also use, maybe if you have other funding or other opportunity to explore research like this. So modeling. We also use modeling when it comes to climate, and that's the main thing now that people use. We did a lot of mathematical modeling to be able to predict, for us to be able to understand how best to respond or to see the possible impact, futuristic impact of maybe climate change on health. So we see a lot of research doing modeling on ecological approaches that we can use to be able to understand what exactly is going to happen, let's say in the next 5 years, in the next 4 years. So mathematical approaches are now being used to model. And if you see, this is an example. These are some examples. For instance, if you want to do research to understand how maybe the distribution of malaria, let's say in the next 5 to 6 years, and you have some data on the current prevalence and incidence, you can do modeling to predict the future distribution of malaria. And this involves you doing sophisticated analysis to be able to do this. So modeling is also an interesting area that we normally explore when it comes to climate change and health research. And this is actually very, very interesting because you are using mathematics to predict the future, to be able to see what is going to happen. And that's a very good approach for people that are interested in using maths to solve climate change problem. So qualitative research, like I said, it's not every time that we want to see numbers. It's not every time that we want to work with numbers. At times, we just want to see people's experience. We want to see their opinion. What do they think? We want to see their experiences with maybe outbreak or something that is happening in their environment. We want to see how they think, how they feel, and what is their own perception of what is happening. So you might decide to do qualitative research to answer that kind of research question. You see something like this, you can decide to explore maybe barriers to climate change adaptation in coastal communities. You can do interview, focus group discussion. You can do in-depth interview. So all these things are also possible ways that we use when we want to explore maybe possible impact of maybe climate change on health. So you can decide to do research to understand possible health impact, or maybe heat waves. Maybe some countries are experiencing heat wave. You want to see what are the possible, what is the perception of these people regarding this heat wave and possible implication on their health. So this is much more maybe for a very short project. You can also decide to maybe explore this for your research. So there are a lot of things that we still don't understand in LMICs regarding climate change. In fact, there's some research that we don't not reach that level. So, but that's why there's still a lot of work that we need to do when it comes to climate change impact on health. So you can start to explore social determinant of health in a context of climate change, maybe in a community. Okay, what is the impact of relationship between poverty and what they think about it? Is there any relationship between poverty and climate change? Of course, it's always difficult for you to be able to measure or determine poverty, because now people fall into poverty, people move away from poverty in a way that maybe their standard of living actually improves. So you can start to do interview to do some of those interesting research to see whether is there any relationship. What do people think? Is it that people at the lower level of poverty ladder, are they the one that actually feels some kind towards climate change? There are a lot of thinkings that we need to start doing as young researchers to explore things that, of course, for me, really, if I want to do research, I try to look at interesting areas and interesting topics. So if you want to come up with your own idea, don't just do what everyone is doing. Try to look for innovative projects. And innovative project doesn't mean that you have to spend millions of dollars to do that kind of project. It's just about thinking what is going to be impactful in a certain community. So you can decide to do research on the link between poverty and climate change. Is there any link? Is there any relationship? Are we talking about what's the perception of people living with disabilities and climate change? So kind of thinking. There are a lot of things that we've not explored. So you can decide to start thinking about possible links. What is the relationship between mental health and climate change? You can decide to do maybe qualitative research into that to understand what do people think. Is there any possible relationship between these outcomes and exposures? So this GIS is also what people do now. You see that big map. If you see most papers on climate change, you see maps trying to map out where we have maybe malaria, where we have cholera, where we have flooding, and the possible relationship with access to healthcare. This is another approach that you can use in your research, which involves using geographic information system. You see those big graphs where you map out exactly what is happening in different community, in different region, across country, and possibly you're able to see links. For instance, if there is a form of flooding in a community and you use GIS, which is like a form of map to map up a particular community, you can easily see where we have outbreaks and whether there's a relationship between flooding in that community and the outbreak of, let's say, cholera or outbreak of an infectious disease. So for instance, if you look at the map and you see that maybe this area, we have a lot of flooding over time, and people living around this area are likely to come down with cholera. So that's an interesting way to map out or to use GIS to be able to see possible health impact of climate change. And you see something like this, you can do spatial analysis of waterborne disease outbreak and climate-induced events. You can see maybe in a particular region, there's a lot of waterborne disease, and you can look at, okay, is there proximity between those region to be able to map out, oh, indeed, this should be responsible for it. But this still requires to do some form of training to be able to understand how to do the mapping. And of course, a lot of courses and trainings are actually available to do to understand how to model and how to use GIS in your research. But it's an interesting way to visualize and see exactly where we have outbreak or where we have a particular health event and the possible link based on what we are seeing on the map to see whether there is flooding in that particular community or whether there's any form of climate change issue that might lead to the outbreak. So GIS is also an interesting way to explore that kind of research. Reviews are also relevant because people tend to forget reviews, that, oh, reviews, we don't need to do review, or reviews are secondary research. Reviews are also very, very important. For instance, maybe we have quite a lot of research on malaria and seasonal variation based on climate change. You can decide to do a review to connect or bring evidence together and see, okay, exactly what is the flow. We have narrative review, we have scoping review, we have systematic review. So we can use review to also understand what is happening, to have an overview, an understanding of what is happening at this present moment, what are the gaps that we have in knowledge. because reviews will allow us to understand what is known, what is unknown, and what exactly do we need to do now. So if you don't have enough time, reviews is also another thing that you can explore to be able to understand what is happening presently in a particular area. For instance, you can try to do maybe a review on COVID and climate change, maybe review a lot of documents or evidence that we have. Maybe there's a possible link between the two. You can try to do all sort of interesting review to just bring the evidence out that, okay, what do we know about this particular topic? What is the thing that we don't know? And how can we move forward from here? So reviews, don't forget reviews. Reviews are also a very good way for us to be able to bring evidence out and understand how best to approach some research question. So another important thing is, of course, commentaries, viewpoints, perspectives, and opinion articles. Well, they are also relevant because I believe this kind of, they are not research method per se, but there are also ways we can communicate or we can engage with the community or we can bring our idea of advocacy. We do a lot of advocacy when it comes to climate change. We have been doing a lot of work, but are we missing out some population? For instance, we might be missing out people, maybe people living with disabilities. You can try to write and maybe a commentary to point out the gap in our policy approach. Oh, we have been doing a lot of things on climate change, but we're not talking about the mental health side. Or is there any link between the two? You can try to write the commentary. What do you think? Your viewpoint. So we don't need to say this kind of topic or this kind of approaches to maybe generating or doing advocacy is not enough. There are quite a lot of things that we can talk about and bring attention to. And this is what you can use viewpoints, commentary, perspectives, opinion articles to do. So, but of course, before you can write this kind of papers or do this kind of research, you need to know what you want to talk about. You need to know what you want to bring into spotlight. You need to know what exactly you want to, the kind of arguments and points that you want to make. And I'm sure there are a lot of things that we've not explored. For instance, if you look at antimicrobial resistance and climate change, that's also another area that people can explore. So you can be the one that will talk about this, that will give us insight on what are the possible relationship between these two things. Then you write a beautiful essays to bring it into spotlight. So collaboration is key, of course, because if you look at climate change, you see that it is multidisciplinary, it is interdisciplinary in a way, because you have to bring many people on board, from epidemiologists to public health experts to sociologists to anthropologists. So we need to work together to be able to develop or answer sophisticated research questions. For instance, if someone is an expert in GIS, maybe me as an epidemiologist, I might not know anything about GIS. I might need to be maybe someone that is doing something on field is maybe urban science or geography, to be that person on board, to work with the person. And I'll bring my own perspective as an epidemiologist to talk about, oh, what about if we do it this way, if we do it in another way. So collaboration is key when it comes to doing research in climate change, and different perspective from different people actually is going to do a lot of help or aid to our project. So when you're thinking about climate change and research, we don't have any unique approaches for doing research. There's no new ways. It's just you connecting ideas from different fields and using them to be able to answer research question. And yeah, exactly. That's what you saw when it comes to doing research in climate that has to do with climate change. So I think I will. We can ask questions at Q&A now. Thank you very much for following.
Thank you so much, Yusuff. If I understand correctly, you're done with your presentation, open for questions.
Yes, right.
Wonderful. Thank you so much. I think that was a great overview of the different possibilities of what to explore in research. So yeah, the floor is yours to our listeners and participants today to ask more in detail questions about how to guide your finding of the right research methodology for your research. You can ask in the chat, or you can also raise your hand to speak. But I do see a question in the chat, which is, what is the best research methods for secondary data? I think that's a really good question, considering that our participants only have 3 months. So that will probably be more feasible. What would you tell them to use as guiding questions to find the right secondary data method for them?
Oh, well, okay. So regarding secondary data analysis or research methods, well, I don't know presently whether you have any access to any maybe open data. That's another thing that you can explore for your research. There's some databases that are open for researchers to have access to the database and use for their research. You just need to take permission. Some are even open to the public, because I've used quite a lot when it comes to doing epidemiological research. So, but I don't know a specific data, smart proposal, what you want to do, and they give access to the data. So I don't know whether there's any open data source like that for climate related research. But another thing that you can easily do when it comes to you doing secondary research, if you don't want to do secondary analysis of data set that we have, you can simply maybe just do reviews. You can do review, but if you want to do review on this kind of topic, you have to make sure that of course, we have enough evidence for us to be able to maybe review something. Or if you decide to spotlight something, you can also decide to use to do systematic review and see, let's see what number of papers do we have in these particular areas and which area should we focus on. So review is also a secondary approach that you can use. You don't need to get any ethical approval or any permission. The databases are available. You can use Google Scholar, you can use PubMed, you can use Scopus, Web of Science to have access to databases, and you can get interesting papers that you can review for your work. There are a lot of papers on that will be interesting to explore, even with doing review in a short period of time. So you can do scoping review as well to be able to explore topics. But if you have access to open source databases, I know maybe WHO might have some data set that you can analyze or something, or you can even do simple research, like you can decide to look at climate change policy around the world and compare. Do we even in Africa, do we have any policy at all in place? You can review policy documents across board. These are interesting thinking. It's not about how big, it's about the thinking at times. It's about what exactly you want to do and how interesting, how applicable or how impactful it's going to be. For instance, you can decide to do a review. You can review policy documents, maybe in Africa, in West Africa, for instance. Do we have any policy on climate change? Is there any rule? Is there any regulation? What are government doing? That would be an opportunity for you to spotlight something that, oh, government are not even doing anything. We are not doing anything. We don't have any policy. We don't have any rule. You can start to compare with high-income countries. Is there any variation? And what you need to work with is just documents. And documents are available everywhere. Just go online, you see. You'll be able to say, okay, is Nigerian government, are they saying anything? Algeria government, are they saying anything on climate change? What are they saying? You can do critical analysis of those kind of things. In fact, there's some research approaches that you can use YouTube videos. You can search for YouTube videos and analyze them and do analysis on them to be able to bring out what are people saying. You can use TikTok. There are a lot of approaches that people are using now. You have to be innovative when it comes to research. You can go on Google Scholar and search for TikTok. You will see a lot of research that people have used TikTok to answer research questions. You can use Twitter. You can use Facebook. You can use new things. So, but what is important is that you being able to frame and you have a good understanding of what you are looking out for and how you want to approach the research question. So you don't need to, that is the research that you can do within the short period of time that you have, and it will still be impactful. Yeah.
Great. Thank you so much for this elaboration. And I think you said something very important that I think is important to take away here today as well, that finding your research topic is not only happening on paper and in your group discussions, it's also looking into the database. It's looking what has already been written on the specific topic and where research gaps. So this is something definitely to take into account when finding your research topic. I'm just going to continue reading out some questions to you, Yusuff, that are coming in the chat. The next question would be, could you share some advice for refining a research question to make it more specific and realistic?
Well, the very first thing is You have to think about the time and the resources that you have. For instance, now I don't think you want to do research that maybe with large sample size of maybe 5,000 or 50,000. So you have to think carefully about the time that you have, the resources that is available. When you are doing any research that maybe you want to answer the research question within, let's say, 2 or 3 months or 4 months, you have to try as much as possible to be specific with the research question. And being specific means that if you want to answer that research question, it is clear what you are looking out for. Not that you are looking for quite a lot of things that are convoluted in a way that it will be difficult for you to answer the question. So you have to make sure that you refine it in a way that anyone can, if you explain it to me that, oh, this is what I want to do, I have a good understanding of exactly what you are looking out for and how you should answer the research question. So you should think, when you are refining a research topic, you should think of it in a way that can you explain it using one sentence? Can you tell someone that this is what I'm doing just in few sentences and you are done? So when you are refining, look at the resources that you have, the time that you have, and how much maybe expertise that you have in that area. For instance, it might be challenging to even do a systematic review, really. Because if you want to do systematic review within a short period of time, you have to screen papers, you have to be sure that you don't miss out any paper. But you can try to do maybe narrative review. Narrative review doesn't require you doing maybe a systematic search. Just about you writing a meaningful write-up based on papers that you can have access to. But if you want to do systematic review, you have to pay close attention and make sure that you don't miss out any paper. But you have a luxury of doing maybe narrative review, where we just write things together, bring out the evidence, what do we know based on what you've seen, and do your own analysis. So when you want to refine any topic, think about the resources that you have, the time that you have, and how easy it is for you to explain what you want to do clearly. So it might even be possible for you to just focus on just one research question because you don't have the time to focus on too many things. So think about what you can answer. For instance, if you want to do something on you maybe reviewing policy documents in West Africa. West Africa, we have quite a number of countries there. So is it all the West African countries? What are you using to do the cutoff? Are you using ECOWAS classification of West Africa? What are you? So you have to make sure that you are specific with what you are doing. If you are focusing on Nigeria, okay, are you reviewing policy just on Nigeria like as a whole, or you are looking at maybe the policy in maybe local government or maybe state region? So you have to make sure that you think clearly on what you want to do. That it's clear in your mind what you are looking out for when you are doing the research. So that's how you think about specificity when you are refining research topics.
Wonderful, thank you. I'm just going to continue here at the chat to get as many questions as possible covered in the time that we have you here. The next one, though, I'm just going to answer it quick. Is climate a priority in the research we're conducting? Yes. So the whole lab idea, the whole purpose is to conduct more research on climate and health. So make sure that your topic is definitely covering climate change. But the next question goes to you, Yusuff. If a team decides to use the review methodology, do you think it is important to stick to a range of years for publications to review? And do one need to note the exact websites that were consulted for the review? So this is about taking notes of everything you're doing. What do you have to document?
Yeah, if you want to do a review, the very first thing, one of the things that you have to consider, after you have a specific topic that you want to work on, is to understand how do you want to search for the evidence? Like, where do you want to get the papers from and from which year? We have a lot of papers, people are publishing a lot of papers every year. So if you are looking for papers, you might decide to say, okay, maybe that topic is what you are using. But there are some topics that we have a lot of research on them. So you might need to say, okay, let's look at papers from 2010 to maybe present date. You can try to maybe use a cutoff based on the evidence that is available. But there are some topics that we have limited evidence, even from 1980 till now, we still have limited papers, limited resources on those kind of topics. So you might not need to maybe use any cutoff. But there are some topics that we have a lot of evidence. So you might decide to use maybe 5 years evidence, or you can decide to look maybe for 2010 till present date, look at those evidence and use them in your research. So you have to set, when you're doing a review, especially when you're doing a systematic review or even scoping review, you need to have the criteria that you are using to select papers that you want to include in your research. And one of the things that you have to consider is even language. You might say maybe you are focusing on English language alone. Maybe you don't have the resources maybe to have access to other languages. So you can use language restriction, you can use date restriction of papers across years. You can decide to say maybe from 1980 to present date, if it is relevant for your research question. And where you can search for climate-related research papers. Actually, Google Scholar is a very good place if you don't have maybe university subscription, because if you want to use Scopus, if you want to use Web of Science, you have to maybe work with a librarian or maybe have access to institutional access to these databases. But if you don't have access, PubMed is free. You can access PubMed, you can access Google Scholar and search for using keywords to search for the papers that you want. So Google Scholar is free, and Scopus PubMed, Medlin, they are free. But Scopus Web of Science, you need to get maybe institutional access, which I know some of us might not have access to those kind of databases, but I'm sure Google Scholar is comprehensive enough really for you to do some reviews, and you can complement that with using PubMed or Medlin for your search. How about me to answer your question? Yes, you need to note the exact website. Of course, when you are reporting, you need to mention the databases that you use. Where do you get those papers from? When you are doing a review, you need to explain that. You need to explain that.
Wonderful, thank you. Maybe one question, because I think that would definitely help the participants as well. We talk a bit about different reviews right now, but how would a team know what kind of review, a narrative review, a scoping review, a rapid review, a systematic review? How do you navigate finding the right review for your team and topic? What are the aspects to take into consideration here?
Well, what is important is, I think, the research question. What do you want to like? What do you really want to know? For instance, if you want to maybe understand the relationship between maybe climate change and asthma, maybe asthma prevalence or incidence, you can easily do a systematic review for that. And what you have to do is to get papers that publish maybe things on climate change and relationship with on climate change and on asthma, or maybe disease that you are trying to examine, and extract those information on the incident and document it. So you have to do is you have to use a systematic approach, because you also have to screen those papers to be able to understand which one is of high quality, which one is of low quality before you include any papers in your review. So you have to be very systematic when you're doing that kind of review. But if I'm review that's just general, maybe you want to look at the relationship between mental health and climate change, you can try to do a narrative review. Just write a narrative review based on the headings and sub-headings that you have to see what do we know presently on that topic and what are the things that we don't know. So the thing that we actually determine whether you're going to do any kind of review, the approach it's actually highly dependent on the research questions that you have, that you want to use for that review. Because if I want to get maybe high quality evidence, I'm definitely going to do a systematic review, because from the word systematic, you don't just include any papers. But for narrative review, you can include any papers. So far, they are giving you some insights on that topic. And also, you can try to do rapid review. Like, for instance, if you want to review government documents, that one, you don't need to be systematic in your search. Of course, where you have to go is to maybe go to government websites, Ministry of Health, get the information from them. So you can do a rapid review, getting documents from maybe Ministry of Health, maybe governments in a particular, maybe West Africa or the region that you're examining. So what determines the approach that you're going to use is actually led by the topic that you have at hand.
Great, thank you so much. I think that was really helpful to get that advice as well. I would say we take the last two questions, and then we're also heading towards the end of this training session. The next question will be, which kind of methodology will be the best for a study which aims to analyze the emissions of CO2 coming from healthcare?
Monitoring. Environmental monitoring will be the best approach for you to use that kind of research. For instance, if you have an hypothesis that maybe there's a relationship between maybe you notice something in the maybe the healthcare environment, and you want to maybe measure the CO2 maybe emission, you can start to do to collect data on the CO2 emission. And that will be there are a lot of approaches that you can use for that. So you can use environmental monitoring to be able to quantify whether what you hypothesize, what you are thinking that is happening, whether there's any form of relationship between that and CO2 emission. So you can decide to collect maybe CO2 emission using different approaches in that healthcare setting. Once you've done that, then you can see whether is there any relationship between that and what you are thinking. For instance, maybe you are thinking there's a relationship between that and admission rates in the healthcare setting. Then if you collect the data and you see maybe an increase in CO2 emission, there's an increase in hospitalization, or you have other hypotheses that you're thinking about. So you can use environmental monitoring to be able to get that kind of data. So you just monitor maybe daily, a particular time in the day, you monitor the CO2 in that particular, the concentration in that particular community. There are a lot of indexes that you can use for that. So once you monitor that, you document it, you can do that maybe over time, then look for whether there's any relationship between that and what you are trying to explore. So you can use environmental monitoring for things like that. In fact, you can use that for also water quality. Maybe you notice for something about water quality and maybe relationship between water quality and a particular outbreak. You can decide to collect data on water quality index in that community and see whether there's a relation between that and the outbreak. So environmental monitoring will be the best approach for you to answer that kind of research question.
Thank you so much. And also, as we said before, consider the feasibility and what skills you have in your team. What skills can you use? What knowledge is there to use each one of these approaches? Because you will need a specific background, and we have a very interdisciplinary group. So some of you might be able to do these kind of things, but maybe not every group. So make sure your skills are matching your research question. Then we have another question asking if you are conducting a research to explore the healthcare sector's leadership and contribution to advancing climate justice, do you think it would be advised to use comparative research?
Yeah, of course. You can start to use that if you think it's going to be, of course, will be useful for you to be able to answer the research question in details. But if I may ask, what are you trying to compare? Do you have anything that you want to compare?
Yeah, very relevant follow-up question. Let's see if we get an answer from that. Otherwise, you might also be able to think through what you want to compare first and make sure that this is comparable in the first place.
Exactly.
But maybe let's put this question back as long as we don't have the follow-up information that you might need, and take a last one that we have in the chat before we kind of let you free. We've taken a lot of your time already. But I think that is a very interesting, important one as well. What are the things to look out for to identify a quality paper?
Of course, it's the knowledge of the methodology. So you have to read the method and think in the sense that, is there any issue with this paper in the first place? Because nowadays that we have a lot of people doing a lot of things with data, so you have to also make your own, of course, decision based on what you read before you can assess quality. But generally, we have some checklists that you can use to assess quality when it comes to different study designs. So we have Robinson tools, we have Strobe checklist, we have, based on different study design, we have different checklists that you can use to be able to assess qualities of papers. So maybe you can check that out and use it. But of course, if I want to read if I'm reading any paper, I also try to think critically, is this really possible? Is this feasible? Is there would they have done it better? Or is there going to be a new way to be able to approach this kind of research question? So you have to think critically before you use any paper. In fact, there's some evidence that in fact they are not useful because the way the research was done, like the design was really poor. But you have to read the method, the design, the statistical analysis. That's also very, very important, because if you use the wrong approach to analyze data, you're going to get the wrong answer. And if you use the wrong design, always you're going to get the wrong answer. For some research question, the best approach is for you to use, maybe to do interviews or to use cross-sectional study. So if you are using another method, then you can be sure that it might not capture what's actually happening maybe in that environment or in that community. So that is actually dependent on the researcher to look at the paper and make some judgment. So, but there are some checklists that you can use based on the study design that will be helpful to you to be able to make the assessment. In fact, if you want to do systematic review, you need to do assessments of the papers that you are including in your review. And that's quite a whole lot of things. That's a big class on its own to explain how to do a systematic review. But generally, you still have to assess the quality, the risk of bias. That's what we call it. There's some papers that are really biased in the way they recruit people into the study. So you have to look at the paper and see, okay, they use 1,000 people to represent the whole of maybe Nigeria or the whole of Kenya. Is that representative? So you'll be asking those questions. And most researchers will also try to explain some of the limitations of their study, because no study is actually perfect. You can't have 100% a study that is 100% perfect. So, but your own is to look at the paper and look at the possible limitation and see, okay, whether they've highlighted that, and you can use the paper if you think that is okay for your research. But no research is also perfect. We always try to explain what we think are going to be possible biases in our study and try to do some justification. That's why research is self-correcting, in the sense that if you have a findings today, if you get something from your research today, tomorrow it might not be true again. So people are doing new things, new approaches to answer research questions. So don't think that your research needs to be 100% perfect. You don't think that way. Just do your best to make sure that your research is reproducible. Like someone can look at your research and understand what you've done clearly. So that's one of the things that we aim for when we are writing research methods. Reproducibility is very, very important. Can someone look at my paper and be able to reproduce what I've done and still get the same answer in your mind? But no research is 100% perfect.
Absolutely. Thank you so much, Yusuff. I think we're going to close the questions for now. I think your insights were incredibly valuable. I learned a lot. I'm sure our participants did as well. Thank you for your time. And I'm just going to give a very short roundup with an organizational aspects to our participants real quick. So this might have been quite a lot of input for you now. Please keep in mind that there will be following up training sessions. The next training session on the 13th of April will specifically focus on secondary research collection. So you will get more information on all these aspects that we have touched upon today. So don't worry if not everything made sense from the very first second. I see, Yusuff, if you want to add something. Is that a hand? No.
Yeah, maybe when you're done. When you're done.
Go ahead.
Okay. So I actually have a YouTube channel that I've started to talk about research for maybe people that want to get involved in research, undergraduates, or people that are actually new to doing research. I'll be dropping the link in the chat box if you can try to subscribe to my YouTube channel. Thank you.
Absolutely. Thank you for adding this, and everybody, please have a look. It's going to help you for sure to look up all this existing knowledge already. Besides that, wonderful. There you also see the YouTube channel. Besides that, take the next 2 weeks, please, to continue to clarify your topic. We really hope today's training session has helped you. You now have 2 weeks to prepare for the team proposal presentations, which will happen on the 30th of March. So get ready to prepare for this. And after this, we're actually going into the active researching phase. Please think back to the beginning of our today's training session of the Mentimeter. It is totally normal if you face a few starting challenges in the beginning. This is the time to practice overcoming them, to sit together. Also addressing all the team leads here, really take that opportunity to sit down together with your team and openly communicate about any challenges